Good afternoon, Peter Goertz. I'm a psychiatrist. Do you know what it feels like to be severely depressed? Maybe not. Do I know what it feels like to be severely depressed? Also maybe not. Unless we've been through that state of mind ourselves, we may really not be able to know what it feels like. And that can lead to frustration on the part of psychiatrists, feeling overwhelmed. They don't know how to help. They'd like to help a patient with severe depression immediately or as soon as possible, and that can be a real challenge. The psychiatrist may feel overwhelmed, and that can lead to frustration on the part of the psychiatrist. But if we can try and understand the emotion of people as best we can, what they're really going through, that can help us to care about the patients and to care for them. And what brought this to my mind was I saw a patient with severe depression, self-neglect, and his skin was in bad shape. He was admitted to a medical floor, had not been taking his psychiatric medicines. So people can really get to a point where they're physically ill if they have severe depression. They can also die by suicide. They can resort to alcohol, drugs. In self-neglect, there can be an underlying psychosis, underlying dementia, but also often underlying depression. And in fact, there's something called pseudodementia, which occurs in depression and can look like dementia. So someone with pseudodementia may give a lot of I don't know answers, not really try to answer your questions, and that can help you differentiate from actual dementia. And if someone's severely depressed, they may not be eating, not drinking, not showering. And it can get to a point where in severe depression, people are a danger to themselves. And we can try medication, we can try ECT, electroconvulsive therapy, which may sound drastic. On the other hand, severe depression can be drastic itself and can be lethal. And psychiatric hospitalization is often necessary if someone is severely depressed. If someone's very depressed, psychotherapy often is not helpful. Let's say if someone feels worthless, it can be very difficult to reason with someone like that. And you can try and advise them, improve your diet, exercise, but that may well not be fruitful. And the underlying issues may be from a combination of many years of adverse experiences starting in childhood, but addressing those when someone is severely depressed may also not be fruitful. They may have no interest in psychotherapy, and it's understandable because they may have no interest in life itself. So this goes for other psychiatric illnesses also, but what impressed me today was that patient being so depressed and not taking care of himself to the point where he needed medical hospitalization. And it's worth trying to have some kind of understanding where these people are coming from, and that can help in treatment, help us to provide treatment, and also can help us not to burn out ourselves when treating patients who are in absolute despair. Thank you very much.